Hello friends, today we'll see about options for hemodialysis in patients with unsuitable superficial veins or who are not good for arteriovenous fistulas. Now these options are three in number. 1. A perm cath placement, 2. An arteriovenous graft placement, and 3. A HD sheath placement. Now let's start with perm cath. Now perm cath is a synthetic material which is in the form of a tube which is kept in one of the central vein, either in the neck or in the thigh. Now with the help of this perm cath, the blood is taken, filtered and given back as is done in any dialysis. Now the advantage of perm cath is it can be used immediately, say on the same day on which it is kept. There is no waiting period or no maturation required for a perm cath. But it has its own disadvantage, like it is costlier, it has high chances of infection, and it requires an expertise to put the perm cath. Now coming to the second option, which is an AV graft. AV graft is also a synthetic material similar to a perm cath, but in this it functions like an arteriovenous fistula because one end is connected to the patient's own artery and the other end is connected to a patient's own vein. Now the maturation time for a graft is about 2 days to 2 weeks depending on the type of graft that has been used. Again, in AV graft, being a synthetic material, there are high chances of infection, it is costly, and again there will be chances of failure which are more when compared to an arteriovenous fistula. The third option, which is an HD sheath. Now HD sheath is also made up of a similar material as the perm cath and AV graft, but the placement of an HD sheath doesn't require any OT setting. It can be done in emergencies in the ICUs or in the emergency room. Placement of a HD sheath for long-term dialysis is not preferable because the chances of infection are higher in a HD sheath compared to perm cath and AV graft as well. But they are preferred in emergency settings because it is easy to do, it is cheaper, and it can be removed and replaced with a perm cath whenever required. Thank you.